Are sulfur burps or an upset stomach making your Mounjaro journey harder than it needs to be? You're not alone, and in this video, we're going to explain exactly why these symptoms happen and what you can do about them. Before we dive in, this video is for educational purposes only. Please don't change your dose or treatment schedule without speaking to your prescriber first. If side effects are troubling you, always speak to your doctor or pharmacist. So let's start with the basics. In the UK, Mounjaro, the brand name for tirzepatide, is licensed for the treatment of type 2 diabetes and for weight management in eligible adults. It's a dual GIP and GLP-1 receptor agonist, which means it mimics two naturally occurring gut hormones that help regulate blood sugar and appetite. One of the key ways it works is by slowing down gastric emptying, the rate at which food leaves your stomach. This is really useful for managing blood glucose and appetite, but it also means food sits in your digestive system for longer, which can lead to nausea, bloating, diarrhea, and belching. Those sulfur burps happen when sulfur-rich foods, things like eggs, red meat, garlic, onions, and cruciferous vegetables like broccoli and cabbage, ferment in a slower-moving digestive system, producing hydrogen sulfide gas. The exact mechanisms behind these symptoms are multifactorial, but delayed gastric emptying is thought to be a key contributing factor. According to the medication's prescribing information, nausea and diarrhea are both classified as very common side effects, meaning they affect more than 1 in 10 patients. The good news is that for most people, these symptoms tend to ease as the body adjusts to treatment. When it comes to managing sulfur burps, diet plays a significant role. Reducing your intake of high sulfur foods, particularly in the early weeks, may help. Eating smaller portions and avoiding high-fat meals can also reduce the burden on a slower digestive system. For diarrhea, staying well hydrated is really important. Avoiding greasy, spicy, or very high-fiber foods during a flare can also help settle things down. Short-term use of loperamide is sometimes considered, but only under the guidance of a healthcare professional, so please don't self-medicate without checking first. One of the most effective ways to reduce gastrointestinal side effects overall is gradual dose escalation. Mounjaro is designed to be started at a low dose and increase slowly over time, in line with UK prescribing guidance. This gives your body time to adjust. If you're struggling after a dose increase, speak to your doctor. They can advise on the best approach for you. There are some symptoms that do need prompt medical attention. Contact a healthcare professional if you experience severe abdominal pain, persistent vomiting that stops you keeping fluids down, blood in your stools, or signs of significant dehydration, such as feeling very dizzy, passing very little urine, or feeling extremely weak. These are not typical side effects and need to be properly assessed. And if you experience any side effects from Mounjaro, you can report them through the MHRA Yellow Card scheme at yellowcard.mhra.gov.uk. There's a link in the description below. To recap, sulfur burps and diarrhea are common with Mounjaro, particularly early in treatment or after dose increases. They're linked to how the medicine slows gastric emptying and alters gut hormone signaling. Dietary changes, staying hydrated, and following the gradual dose escalation schedule can all help. And always speak to your doctor or pharmacist before making any changes to how you manage your treatment. If you found this helpful, leave a comment below, especially if there's a specific side effect you'd like us to cover next. Please do like this video and subscribe to the Bolt Pharmacy channel for more medically reviewed health content.